COVID-19 Awareness and Prevention. What you should know. What is COVID-19? What are its preventive measures? What is the current statistics of COVID-19 in the Philippines? Whom to call and where to go. A quote from Dr. Tedros Adhanom Ghebreyesus, World Health Organization's Director General. We cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. History of coronavirus. The oldest common ancestor of coronavirus has been dated as far back as the 9th century BC. Some studies published in 1990 specified the most recent common ancestors as follows. Delta coronavirus during 3000 BC. Gamma coronavirus during 2800 BC. Beta coronavirus during 3300 BC. And alpha coronavirus during 2400 BC. The following are common symptoms of COVID-19. High fever, body temperature can exceed 37.3 degrees Celsius or 99 degrees Fahrenheit. Patient may feel tiredness, or the body feels completely tired and without energy to perform normal tasks. Patient may experience dry cough, or throat irritation and constant coughing without expelling any mucus. How is the virus transmitted? The virus can be transmitted through people and from surfaces. This disease can spread from person to person through small droplets from the nose or the mouth when the infected person coughs or sneezes. These small droplets land on surfaces, which means any person that touches these surfaces and then their eyes, nose, or mouth can become infected. You must know that there are asymptomatic people. Many people infected with COVID-19 show mild symptoms, especially during the first stages of the disease. Thus, you can still catch the disease from an infected person who only has a mere cough and does not feel ill at all. This is an infographic on the symptoms of COVID-19. High fever, the body temperature can exceed 37.3 degrees Celsius. Tiredness, or the body feels completely tired and without energy. Dry cough, or constant coughing is experienced without expelling any mucus. Difficulty in breathing, or breathing feels more difficult. What to do if you have symptoms. If you have symptoms or have been in an infected area, call the designated or mock city COVID hotline number. You will be given an instruction over the phone to immediately isolate or quarantine yourself, immediately and strictly follow the instructions. Report if other symptoms develop while in quarantine. Do not panic. About 80% of people recovered from this disease without having special treatment. Philippines statistics on COVID-19 as of June 20, 2020. There are 29,400 reported cases, of which 7,650 have recovered and 1,150 deaths, bringing the death rate at 4%. Preventive measures. You must know that antibiotics do not work against coronavirus. How to protect yourself and prevent the spread of the disease. Wash your hands with an alcohol-based sanitizer or with soap and water. Keep a distance of at least 6 feet between yourself and anyone who coughs or sneezes. Try your best not to touch your eyes, your nose, and your mouth. Cover your mouth and your nose with your bent elbow or a tissue when coughing. Seek medical attention if you have difficulty breathing and a high fever. Follow the directions of your national or local health authorities. Protection for people that are in or have visited infected areas. Stay home if you do not feel well, even if you feel mild symptoms such as headaches, slight fever and a runny nose. If you need to go out to buy food or supplies, wear a mask to minimize the risk of infecting others. If you have difficulty breathing or have a high fever, seek medical advice as soon as possible. Call your provider and inform them of any recent travel, especially to countries or localities with reported cases. How to use a mask. Before wearing a mask, wash your hands with an alcohol-based disinfectant or with soap and water. Cover your mouth and nose with the mask and make sure the mask is firmly pressed against your face. Do not touch the mask while you are wearing it. If you do, wash your hands with an alcohol-based disinfectant or with soap and water afterward. Replace the mask as soon as it gets wet and do not reuse disposable masks. Remove the mask from behind, do not touch its front side, throw it away in a closed container and then wash your hands with an alcohol-based disinfectant or with soap and water. For updates, visit the Department of Health COVID-19 page through the following link: doh.gov.ph/COVID-19 tracker. For immediate assistance, call or mock COVID hotline numbers 091735866916 and 5615983. Thank you for your time. Stay safe everyone, and may God bless us all.